Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
Do you ever suffer from runny noses? I mean, you always think about that with kids, right? Well, but have you ever seen people, they always have a Kleenex in their hand and always wiping their nose, and then, that's not very healthy. Or let's say it's not really clean for people to do that and be around other people. But you don't know if there's anything you can do about it because you don't really have a cold. Sometimes people say, oh, you always have a cold? No, I just have a runny nose. So I was so fortunate to find one of our great doctors, who is Dr. Sina Joorabchi. And Dr. Joorabchi is an ear, nose, throat specialist. It's otolaryngologist. That's really the proper name. But he is someone that I go to all the time, not for a runny nose, not yet anyway, but to get my ears cleaned out. I'll tell you about that. I don't go just to have a doctor do that. I want to go to a specialist because they do it properly. There's no chance of you having your eardrum hurt or something like that. So we can talk about that later. But I want to get right down to running noses and other kinds of things that people need to have done by a ear, nose, throat physician. So, Dr. Joorabchi, thank you for being on our show today.
My pleasure. Thanks for having me, as always.
Well,
always good to be here.
Yeah, you do. You have such a pleasant way about you. So I know people are never afraid when they come there. What are you going to do? But no, you don't. You're friendly and you're smart, and so that's why I think you're so successful. But let's get down to before we even get into the runny noses. When people come to see you, what mainly are they coming for?
Well, I'm very fortunate where I get to see a wide range of people. I can see anyone from first few days of life to age 99. And very much so in my clinic, that's the range that I see. I get to see all walks of life, all different conditions. So, specifically, for kids, I do a lot of tonsil work, do a lot of ear work. For middle age, a lot of sinus and allergies. And for elderly, I see a lot of people with hearing loss, vertigo, runny nose, sinus, nosebleeds, and basic ear cleaning. So there's a lot of things we do, and we're just very fortunate we can see a lot of people and get to be involved with many people's care.
Okay, well, so when someone needs something, a lot of people think they're having a sinus condition, and it could be something else.
Yeah, so a lot of people have headaches, a lot of people, and that's one thing that's the kind of thing we have to sift through when we see a patient is it migraine? Is it simply grinding your teeth? Is it a tension headache? Or is it sinus? And, sinus, thankfully, is pretty obvious and straightforward because they got a couple different symptoms that will separate them apart from the other things I mentioned. Always will have sort of runny nose, stuffy nose, pressure in the cheeks and forehead that tends to get worse when you bend over, teeth pain, bad breath, cough. Usually if you have a couple of these symptoms, that pretty much gives a tip-off that it's probably sinus. And one of the first things we tend to give is a nasal spray. Because treating sinuses is very much like treating a clogged kitchen sink. You have a clogged kitchen sink, you need Drano. You get a clogged sinus, you get pressure buildup, you need a nasal spray. Nasal spray is the Drano. And if you kind of bring it down to that level, patients understand the utility of the spray, why they need to do it, and why they need to use it for so long, which is usually about 4 weeks. And just like with any injury or any sickness, the earlier you hit it, the better chance we have of it getting to go away. The good part is that, sometimes it doesn't always go that way, but we've had a lot of advances in our field where it's been very easy to address a lot of these sinus complaints, even in the office setting. We don't really have to put patients to sleep that much anymore because we're doing a lot more minimally invasive work. In fact, I just got done doing a full sinus surgery in my office for about 15 minutes, and we were listening to classical guitar music the whole time. It was really easy, no big deal. And, I will tell you one thing, Anita. You come to me, I'm kind of a little bit crazy. I tried most of these procedures on myself because, unfortunately, I've had a lot of dental experiences, a lot of the dentists. They weren't so great or kind to numbing me. So maybe it was kind of a purposeful event that kind of scarred me to really make sure my patients are comfortable. So I don't care how long it takes. I won't do anything until I know they're comfortable, numbed up, and at least happy. And so I think it's important for that. I think you got to put yourself in the chair. So I've done some of these procedures myself. I've used silver nitrate on myself, scope myself. I'm a little bit crazy. Patients will be like, "You really have?" They don't believe me. But yeah, I've done pretty much everything that I can to feel the pain. It just gives you perspective. And, if you understand, then you understand your patient better, and you'll be able to treat them better. So I really value that aspect. So a lot of the stuff we're doing in the office, make sure patients are really comfortable and, can tolerate it.
Well, I knew there was something special about you, but I don't know if a lot of doctors do that. I think that's absolutely superb to do that. The person that you took the 15-minute, I guess it was the in-office. You don't have to take people to hospitals anymore, do you? Because you have a very highly equipped laboratory there, in a sense.
Yeah, we're pretty fortunate. A pretty sweet setup here, Anita. We've been kind to have a lot of. We've been handpicked by a couple companies where they give us some of their best equipment to kind of trial and test runs. We get a lot of cutting edge stuff. But the one thing I'll have to stress is that not everyone is a nail, and the only tool I don't have is a hammer. So a right candidate with the right condition makes a good person to do an in-office procedure. If there's medical conditions, if there's concerns, or if it's a little more advanced, then yeah, we absolutely still have to do in the operating room procedure or intervention. But for the most part, at least in our specialty, we can handle a lot of these things in the office because they're usually not that far gone. And so with this gentleman, we did pretty much a complete sinus surgery without correcting his deviated septum. And I wouldn't do that in the office because personally, I wouldn't want that done to myself, and I think that's a bit traumatic. But everything else, I think, is fair game. And the big thing I tell the patients is they'll hear us popping and cracking. So if you go back to that same thought about the sinus drain, basically, if you have a bigger drain in your kitchen sink, it's less likely to clog up with the junk that goes through it. So that's the same idea we use for our sinus procedure in the office, where we weave in this balloon and dilate it, and it'll pop open the sinus to about 6 millimeters, which is significantly larger than basically about 100% larger where it was before. And so the incidence of it clogging is a lot less. I mean, sure, there's times where it can clog up, but it'll take a lot more to get there. And also, you recover a lot faster from anything else. So that's been a game changer. I mean, I stand behind it. I said I'd do it on my own wife if she needed it. And I've had a lot of success with it for the right patient. And I can't stress that enough. Mm-hmm. That's for sure.
Okay, well, that's one thing. Now, the way that I met all of you there, of course, was through hearing aids, because you have a great audiologist, and that's really important. But while you're there, you ought to have your ears checked. Of course, a lot of people think that they have a hearing problem, and that's not always the case. It could be more of a medical problem. Isn't that true?
Yeah, so I will tell you one of the best things I do is clean ears, because you can restore hearing in about 5 minutes. And that's the best condition to walk into the door. And it's sometimes not bad to have a quick fix. It's not bad to have that every once in a while, to have someone you clean out, and everyone's all smiles when they walk out the door. And so that's the first we look for. And, that can be a great fix. But there definitely can be other things. It's not always just you have hearing loss and need a hearing aid. There can be fluid in the ears. The eardrum could not be in a good position. If you think about how you play a drum, and a drum needs to be light and tight, right? So if your drum is sucked in, imagine a drum that's kind of sucked in, it's not going to vibrate as well. So that's for someone that can't really pop their ears, and that drum is sucked in. So we want to re-inflate that drum. And so that's something I look for very commonly, especially in the elderly, where they can get this thing called eustachian tube dysfunction, where they can't pop your ears. So think a guy that has pain when he flies or can't equalize when he dives underwater. That's one common thing we see. Another thing is fluid behind the eardrum, which, believe it or not, I'm a plumber again here, because there's a drain, the eustachian tube, and the Drano oftentimes works for that area too. So we'll put them on a nasal spray for about 4 weeks, and sometimes that takes care of it. Then it gets a little more esoteric, where there's other, basically a laundry list of possibilities that we look for. But, ultimately, if those are all negative, then there is hearing amplification or hearing device. And the neat part about it is that it's gotten a lot smaller. And let's be honest, no one wants to walk around seeing a hearing aid. And so we actually can color it to the color of your hair. And, I can tell you personally, my dad just got hearing aids, I want to say about 2.5 years ago. I finally got to jump in the pool and finally do it. And it was a game changer. I mean, to be honest, it was really tough to have conversations with him over the phone. He lives in Michigan, and it was very one-sided, where he would talk and I'd ask questions, and he couldn't understand. And when he visits me, it's like we have actual conversations again. And it's really, really nice. And on the phone, it's made a significant difference. We actually can communicate. And so I have so much perspective for patients that go through it. And oftentimes when they come in for hearing loss, they come in with loved ones. The loved ones are frustrated.
Yeah.
And the big thing with my dad is that he was a very social animal. He was the elephant in the room, but he was being more on his iPhone, more on the couch, not in the social gathering. It's because he couldn't hear. And so that's changed. He's back to getting everyone dancing and causing a ruckus to people's chagrin. But it's definitely a big deal to watch out for. I can definitely make a big deal, and I can definitely vouch on that too, personally speaking.
Yeah, I see that, and that is true. And usually it's the kids or the wife or husband says, you don't hear me. Well, you don't talk very clearly. Well,
right.
But the nice thing...
I've been a mumbler to him for
that's
like
right.
20
I've been a
years,
mumbler,
so.
right? All my life. No, I haven't. But the other part that's so nice is it's a one-stop shop. See, that's what's important, because a lot of times you will go to a hearing center, and when they examine your ears, they say, well, we can't do anything. Now, let's say you had to make arrangements to get there, and now you're there, and they don't want to test you because your ears are filled with wax. So here, everything is there. You have the the otolaryngologist, which is the ENT doctor, plus you have and they have an audiologist, not just a hearing educated person. It's someone who's, a doctor of audiology. And they've been there a long time. They really know what they're doing. So I cannot tell people more about it. But let me give people a phone number. I know you've all been saying, so now you're listening to Dr. Joorabchi, and the way you spell that is JOORABCHI. And the office number is 954-438-7171. I'll repeat that. Remember, this is Pencil Talk Radio. If you write it down, you won't lose it. It's 954-438-7171. And they're located in Pembroke Pines they have lots of parking. It's very easy to get to. I just suggest that, I go down there. I live up in Boynton Beach, but I always feel that it's not like you're going to the grocery store every day and you want to go to a close grocery store. If you're going, once every 3 months or 6 months, take the time, whether you live down in that area or somewhere else, go to someone who you really can trust and you admire and who who has the skills. So I'm always telling that to people, because I go to a dentist down in Plantation who I met a long time ago, and he's been taking care of my teeth. And I say, go all the way to Plantation? Of course I do, because he's very good. And so that's something that I do try to instill in people. But now let's go back to this whole issue of sinus. It's funny. If I talk to someone, they'll say, I'm having a bad day today because my sinuses are acting up. Now, they say this when the weather is warm. They say this when the weather is cold. So it isn't just the pollen. It must be other things.
That's a great point. That is a great point. So, sinus has become like a wastebasket term for sick. It's just, there can be many different types of sick, but what's causing it. So, when patients come in, always be like, I have the sinus. So I really dig into their symptoms first. Everyone has a different definition of sinus. But there are quite a bit of people that truly just have overactive nerves. And what that really means is that they have no nasal nerves that are overactive, or they'll drip, they'll congest when they eat certain foods, when they go out into the environment where it's warm, if they get emotional, if they get angry, sad, in the morning, just basically runny nose that has no rhyme or reason. And so there's a nerve responsible for this. It's called the posterior nasal nerve. And what we've tried to do in the past to try to address these people with the drippy, runny nose is use nasal sprays that are targeted at this nerve, intranasal antihistamines or anticholinergics. The problem with that is that it doesn't always work, and it sometimes can cause some side effects, especially the second medication, where it can dry out not the nerve and not the nose, but the mouth, dry out the eyes, and so it's not desirable. So there's definitely a need for this. And actually Stanford University recognized this maybe about 4 years ago. And what we used to, prior to even when Stanford had gotten involved, was actually do surgery on these patients and go basically clip this nerve or dissect this nerve, and that would take care of it significantly. It would no longer have this problem. But that requires surgery. And as I told you, we're becoming much more minimally invasive. And, with our ease of access culture, we want it now, want it easy. So Stanford recognized the need of this, and they applied a long-standing technology, cryoablation, cryofreeze, things that dermatologists use for warts. But what we thought was, if we cryofreeze this nerve in the back of the nose, will it address it? So I have a good friend that's on faculty at Stanford, and it was just kind of ironic that we were talking about the same problem. I was getting frustrated because I do see quite a bit of elderly patients, and I'm just, are you guys working on something? Because, these patients just aren't happy with these nasal sprays. And he goes, have you ever heard of Clarifix? I go, no. He's like, we're just about to publish this study on it, and it's basically caused about 80% improvement rate amongst the population, and it's a very simple application. It takes about 30 seconds. And so basically what they do is it puts this little, looks like a spatula almost, a really small spatula, size of the 1 centimeter size, and you put it in the back of the nose in a specific region, and you almost crack the canister to release the freeze, and it just freezes the nerve for about 30 seconds. Do it on both sides, and it's painless. It does require to be numbed, but we typically just put a numbing pack in the back of the nose for about 15 minutes, and that's basically it. It's painless, it's instantaneous, and they're back to work, back to do their normal thing that day. It's not perfect, so 80% of patients will get the benefit. There is 20% that will need a second procedure to fix it. But patients start to notice the benefit at about 2 weeks. Then at about 4 weeks, they'll notice a 50% reduction. And then in 90 days, it's completely gone. And so I've had people that are in retail, and our practice is right by the mall. So I had this lady specifically, perfect candidate, 63. She sells perfume. Perfume is a chemical, it's an irritant. And so her nose was constantly running, dripping on the glass that, you can picture Macy's. And it was just getting to her. Her quality of life was affected. And so it was a slam dunk case. We did it about 3 weeks ago, and I've seen her at her second post-op visit, and she's already noticed a difference. So I'm really optimistic to see where she's going to be in about 4 weeks, but just already she knows it. And again, it's really easy, very painless, and honestly, I think that we'll probably end up using this set of nasal sprays in the time to come. So I'm really excited about this. I really wanted to get the word out because I know how many people are suffering with nasal drip. I really stand behind this. I haven't done that myself yet. I don't think I'm going to because I don't have the drip.
Right.
But I might just put the probe back there and see how it feels.
Oh.
But on the people who have done it thus far, there's not been a wince of pain, and it's been a success. So there's the company has kind of support us and has basically gotten the word out for us. I wanted to get the word out to all your followers, everyone. I think this is a really nice option. So there'll be a time where either your local ENT doctor or someone in the community can be offering this, and I think it'll make a big difference.
Yeah, I know it will. All you have to do is walk into the pharmacy, go to one of the big pharmacies, they have a whole section just on the medication for sinus conditions.
Yeah, and the problem is with that is that there's a lot of fine print on these medications. And so there's these nasal sprays in particular, these decongestants. And these decongestants, if used more than 3 days in a row, the nose truly becomes addicted to it. Literally, it will crave this decongestant. It will run. It'll be stuffy without the use of this. The problem with these decongestants is that if you continue to use it on a daily basis, it actually break down the structure of the nose. I've seen where it puts a hole in the nose. It actually raises blood pressure. And patients are always stuffy, and they're relegated to be using it on an hourly basis. You know those people that always use those Vicks Vapor Rubs or
right.
the little Vicks sticks, and the reality is that their nose is addicted to it, and they'd be much better off being off of it. So many times I'm weaning these people off. I tell them to get off the junk, and we laugh because it's kind of like, yeah, it's a nasal spray, but it's true. And I said, you will have a rough week because you're going to be withdrawing the next week. So throw it out. Don't be tempted. But I promise you, in 1 week, you will be much better. So there's a lot of things out there that, if you don't read the fine print, that can become harmful or create another issue for you. Typically, most of the stuff, at least we do here, is evidence-based. If people like Stanford aren't behind it, or people in our field aren't behind it, it has been extensively studied, we're not going to be shooting from the hip here and just experimenting. And a lot of things that make it to the shelves don't always need the FDA approval. Even if you think about vitamins, vitamin is a medication. It causes an effect on the body. But many of them aren't FDA approved. That's the difference between a medication and a vitamin. So, or a lot of these over-the-counter herbals. So they're causing an effect. You need to keep that in mind. You shouldn't just be ingesting because of the stigma of the vitamin. I've seen people that have had vertigo because their vitamin D concentration has been sky high, or the B12 has been sky high. So there is consequences to it.
Yeah,
Sure.
I'm glad you're really covering this. I haven't had anyone talk about sinus like this before, but it's, as you said, it's just an overall word that someone just says. Anything happens, they say it's a sinus condition. In fact, I'm sure some people are getting the flu and they think it's a sinus condition.
Right. And so that's. Speak of the flu. That was a tough one this year, but it's become a wastebasket term, or just a broad term people use when they're having symptoms. But again, there's different fixes for different symptoms. You have to break it down to the symptom level and also your track record. If you're coming in for a runny nose, I'll still try the nasal spray on you, because in some people it does work, but there's a big population of people that fail, and I had no other option, and have just been forced to live with it or offer them surgery. And most people don't feel like a surgery is worth fixing the drip. So this has become a nice intermediary for that. I think it's even 24 million people have this problem
really?
in the United States. Yeah, it's rampant. It's a big deal. So, and it's even more concentrated down here in Florida because of our warm weather. A lot of people have it.
Well, let's go back. We started with the stuffy noses, and so if someone does have, that problem, why don't you talk again now? So again, since you started, but maybe some people just tuned in, they didn't get it. What would you do for someone? They come in and they have a stuffy nose and it's always leaking. It's called stuffy nose, or it's just a nose that's dripping all the time? What do you call it?
So the term is rhinitis, or chronic rhinitis, and there's a couple forms of that. There can be allergic forms, there can be chemical forms. There can be rhinitis due to sinus infection. There can be rhinitis due to temperature changes, foods. There's many different types, but usually when we look in someone's nose and talk to people, we can kind of sift out which type it is. And, if it's a sinus thing, then it's something we treat with the sinuses. If it's an anatomical issue, something we may talk about doing a fix. And if it's potentially this just overactive nerve condition, this vasomotor rhinitis, then we probably would offer a nasal spray that would target that. And if that fails, if that doesn't achieve patient satisfaction, then the next thing would be to offer Clarifix, which is, again, that 30-second treatment where we would just cryo-freeze this area of the nose, and it would just take care of the problem completely. Some people have deviated septums that require treatment. Some people just have swollen tissue in the nose that requires treatment. But one thing I will preach is when you come to my office, I'm going to try to give you the medical management or the least invasive fix. You're not automatically going to be going to the OR or procedure room. We want to exhaust medical management first. And when the most common thing doesn't work, then that's when we step it up a notch. Okay, you need a surgery, you need a procedure, or need further testing. So, I always will still try, again, I think of it like a mom in the chair or my daughter's in the chair. What I want for them. And what I want to be doing, even though these things work, what I want to be doing minimally invasive sinus surgery on them or this Clarifix. And I'd rather do a spray and have them get, fixed in a week.
Sure.
Like the quick fix, like clean the ear.
Yeah.
But at the end of the day, you got to take care of it. And if that doesn't work, then these are great options where it's not aggressive. It can get done. And the turnaround time is fantastic. Where it's just really, for this Clarifix in particular, it's an hour. These people are back to work in an hour. Some of these other procedures where it takes about a week to recover, now it's about a day.
Well, let me tell everybody, if for no other reason, just go meet with Dr. Joorabchi because he's just a great guy. He's very attractive, he's very smart, and he's very kind. And so how can you get that all wrapped up in one laryngologist? But you can. So please do go there. It's very easy to find. It's in Pembroke Pines. It's actually 500 North Hiatus Road in Pembroke. The phone number is 954-438-7171. Again, 438-7171. Or go on their website is browardcenta.com. Is that right?
Yep.
Okay. Thanks so much for taking your time, and go make people feel better.
Thank you. It's always great to see you. Look forward to talking to you as always.
All right. Thank you for me too. Bye.